Hello, my name is Lacey Wolf, and I'm the Health Promotion Administrator at ERS. I'm responsible for heading up the wellness initiatives for the Group Benefits Program, which includes helping state agencies and higher education institutions develop, implement, and further their wellness strategies to promote the health and happiness of our state employees and their families. In this brief presentation, I'm going to be providing you with an overview of some of the data around the top chronic conditions that we saw among participants enrolled in the Health Select of Texas and consumer-directed Health Select plans in the plan year 2018. It's my hope that this presentation will give you some insightful information and some strategies to promote health and well-being at your agency. The data I'm going to present to you today is important. It gives us some information about where the state spends its healthcare dollars, and that can help us to better strategize for how to improve the health of the state workforce. Knowing the top chronic conditions will also help us to better educate our members on how to use their benefits to access care. The data I present today is only for the Health Select medical plan populations. These plans cover about 80% of all participants in the GBP. The data does not include any of the regional HMOs or the Medicare Advantage plans. I'd like to show you how this information can help improve the state's workforce. If we think about how we spend our day, most of us might say we spend a good amount of our time working. If we spend a third of our lives working, then the workplace can play a major role in our health decisions. The workplace culture is going to be a major factor in how we live our lives. If the workplace supports healthy habits, it can have a positive impact on the employee, which could lead to better job performance and improved quality of life for the employee and their family. The state's workforce may be impacted when our state employees are not feeling well. If employees aren't feeling well, they may be absent more. If they are at work but they don't feel well while they're there, they may not be as engaged and could be less productive than when they do feel well. And this could also impact safety of our employees. And quality of life, which also impacts organizational culture, is another thing that is impacted when employees aren't well. Chronic disease hurts the organization from many angles. And bottom line is, if your employees don't feel well and do not engage in activities that keep them mentally, physically, and emotionally well, it can affect their quality of life. And at ERS, we truly want our participants to be healthy and to positively contribute to the state workforce to enjoy a healthy and happy retirement. Now that we have an understanding of why having a healthy workforce matters, let's take a look at the data. These are the top 5 chronic conditions among Health Select participants in the plan year 2018. And from a benefits and wellness coordinator's perspective, what's most important about this data is the fact that all of these top conditions have a behavioral component. We know from research that many of these conditions can be improved or eliminated with healthy nutrition, physical activity, stress management, proper recovery, and sleep. Please feel free. I encourage you to use this data to help you support your wellness initiatives. For example, here's one way that you could use this data to support your wellness initiatives. If we know that musculoskeletal injuries are the top chronic condition for the Health Select of Texas plan, most likely many of your employees are being affected by a musculoskeletal condition, such as low back pain. This data can help you garner support from leadership and from employees for physical activity programs, on-site workout solutions, walking trails, standing desks, etc. It's important to note that these conditions can be, and often are, interrelated, meaning that someone with diabetes can also have joint pain, someone with depression can also have heart disease. Back and joint pain is the most prevalent chronic condition that we're seeing and can be brought on by acute injuries. However, the fact that most people sit for so much of their day weakens core muscles that support bone and joint health. And that's probably one of the primary reasons why we are seeing such high levels of musculoskeletal injury. We know that physical activity can prevent the onset of musculoskeletal injury, as well as can improve many back and joint injuries. Hypertension is a second chronic condition on the page here, and it definitely has a genetic component, but we also know that physical activity or lack thereof, nutrition, and stress play a major role in managing and preventing this condition. Number 3 is diabetes, which we'll go into with much more depth in the following slides. But again, we know that this disease has a behavioral component. Heart disease is next, with almost 10% of our population having dealt with this chronic condition over the past year. And we know that heart disease is the #1 killer of Americans every year for several years now. Lastly, we've got mental health and substance abuse, which is more prevalent than our data suggests, even though we know that 1 in 10 people in the plan had a mental health or substance abuse health claim. The majority of people with psychiatric disorders actually fail to get treatment, according to the research. And what you see here on this next slide is that the risk of chronic conditions will increase dramatically with age. You can see it happening. And the average age of an active employee in the GBP is 45 years old. We know that behavior change in our 30s and 40s, and even before that, the lifestyle that we set in motion from our childhood moving forward can dramatically reduce many of the chronic conditions that are plaguing Americans. The cost of diabetes is what we're showing on the next slide, and we know that the cost of diabetes is far greater than the money spent. It's the loss of quality of life. Participants with diabetes have more medical complications, 53% more ER visits, and 129% more hospital admissions. Participants with diabetes have higher rates of heart disease, and we know that this condition affects all of us. I've personally been touched by the destruction of this disease and hope to do everything I can to help you educate your employees on the wellness benefits that are available through the Health Select and consumer-directed Health Select plans to help prevent the onset of diabetes and to effectively manage it for participants that are already dealing with this condition. Now I'd like to take a look at how prevalent diabetes has become in our country as a whole. The yellow line in the left axis represents the percentage of Americans with diabetes between 1959 and 2015. And we went from what you see here from about a 1% rate to a nearly 8% rate, and it's even higher in 2018. In 1958, only a few million Americans, roughly 1%, were diagnosed with diabetes. And in 2015, that number had grown to more than 23 million. Let's look at this in a little bit different perspective. In 1960, which isn't that long ago, many of our employees were alive, and some of them were in the workforce in 1960. At this point, only 1 in 100 people were diagnosed with type 2 diabetes. And in 1995, 3% of adults were diagnosed with type 2 diabetes. So we can see that it grew quite a bit, but in 1995 doesn't seem like that long ago. That's when I was in high school. Looking back, it seems like yesterday. And let's take a look at what happens moving forward. In 2015, according to the National Diabetes Statistics Report conducted by the CDC in 2017, so it was conducted in 2017 for the 2015 year, approximately 1 in 10 or 10% of adults in the United States have been diagnosed with type 2 diabetes. So this growth is happening so quickly when we look at time, and that's the thing that we have got to figure out. How do we actually do something to get a hold of this growing rate of this chronic condition? In the Health Select plan, what we're looking at here is more specifically our data. And you can see here that we are higher in many parts than the 10% national average. We're at 12.6% on average in the 2018 plan year. And there's definitely a genetic predisposition and a lot of factors to consider, including the social determinants of health, socioeconomic factors, food availability, and education. But if you are in one of these regions where there are higher diabetes rates, or really anywhere in Texas, it's incredibly important to educate your employees and their covered dependents on the programs that are available through the Health Select plan and community or consumer-directed Health Select plan to prevent and manage diabetes, as well as there are various community resources that are available to them. There are lots of things that are out there that a lot of times people just don't know about, and it's our role to help connect those dots. This trend, if it continues along the path that we've been on, researchers predict that 30 to 40% of adults will have diabetes by plan year 2050. And you may be thinking, 2050, that's so far away, and surely someone's going to do something. But the question is, if not us, then who? We have to think about the fact that 1990 wasn't that long ago, and our health disparities have continued to be more prevalent every year, as you've just seen with the diabetes rates. What solutions are available now? This is where we're going to shift gears. It's not all doom and gloom. We actually have some amazing resources that are available, some programs that are offered at no cost to participants through the Health Select and Consumer-Directed Health Select health plans. And I'd like to highlight a couple of these in the next couple of slides. And what we know is that these programs help people change behavior. They work. Both of them work, or all of them work. Health Select plans these programs can prevent, reverse, or help effectively manage these conditions through lifestyle and behavior modification. Both of the programs, as far as weight management that I'm going to talk about in the next two slides, are available at no cost to employees, retirees, or dependents that are enrolled in a Health Select plan, excluding Medicare primary participants who are 18 and older and have a BMI of 23 or higher. I personally know many people who have lost significant amounts of weight on both of these plans and have improved their health and lifestyle. And I'm going to tell you a little bit about each program. The first one we'll talk about is Naturally Slim. Naturally Slim helps employees and their families lose weight and improve their health. It's not a diet. There's no points to count, there's no starving, and no eating diet food. This program teaches participants when and how to eat the foods they love while losing weight, boosting their energy, and improving their health. It's a simple online-based program that boosts understanding of what people who don't struggle with their weight do naturally, and that is where they came up with the title Naturally Slim. The Naturally Slim program starts with 10 weeks of foundations course, which in that part, participants learn skills to retrain their brains and bodies to eat when they're hungry and stop when they're full. After foundations, participants start a second 10-week program personalized for their lifestyle and needs. And after that, the participant can continue on for the duration of the year with weekly lessons to stay motivated. The second program I'll talk about is called Real Appeal. And this program is based on decades of clinical weight loss research, and it focuses on simple steps combined with personal tools and support. Real Appeal members who have attended 4 or more sessions during the course of the program lost an average of 10 pounds. Real Appeal helps participants take small steps that lead to lasting weight loss. The program can be tailored to the participants' goals, preferences, and lifestyle. Weekly online group sessions are led by a transformation coach, and participants will receive a success kit in the mail to assist them on their journey. And you can see the items that participants receive in the success kit on the slide. Please note that with Real Appeal and Naturally Slim, that participants can only participate in one of these programs at a time. You cannot participate in both simultaneously. The next solution that we have available is Well on Target, which is an integrated wellness suite of wellness offerings that helps participants to reach their wellness goals. It includes personalized tools and resources to support health and wellness. Here, participants can take an online health assessment that will guide their health journey. Participants can also find self-directed health and wellness courses, personal health coaches, tracking tools, podcasts, articles, and interactive health calculators to help them live their best lives. Through Well on Target, participants can earn blue points for completing healthy activities that can be spent on items in an online store. I personally bought wireless headphones and a set of camping dishes this year, and my friend just showed me her new iWatch band that she redeemed with her blue points. There's lots of great stuff on there. I highly encourage you to check it out and promote it to your members. It's a great incentive. The Health Select website also contains a toolkit. If you're not aware of this, check this out definitely. This includes communications pieces that you can use to promote the programs that I've talked about today, and also will give you other valuable information that you can push out to your employees. You'll find the toolkit at https://healthselect.bcbstx.com, and then you'll look down. You have to scroll down, and it's the bottom left hand side of the toolbar. That's where you'll find that coordinator resource. Thank you so much for listening to this webinar that highlights our current state of health and some of the programs and resources available to our Health Select participants. I welcome your questions and comments. My email is listed here, so if there's anything that you would like to follow up on, please feel free to email me. And I look forward to working with you in the future to promote the health and well-being of employees and their covered dependents through the great state of Texas. Thanks so much.